Hello and welcome. You're watching Medically Speaking, and I'm Pragati Singh. This Mental Health Week, we aim to bring forth mental health issues during the COVID and post COVID. For the same, I have with me Dr. Shishir Palsapure, Director of Morphic Minds. Welcome, sir.
Thank you very much, Pragati. Yes.
COVID-19 pandemic represents merely the tip of the iceberg when it comes to poor mental health outcomes. It is an iceberg we have been ignoring for far too long, and unless we act, it will continue to have disastrous results for children and societies long after the pandemic is over. My question to you, sir, what really do you think is the severity of this issue, and why is it so important to talk about the mental health condition?
The severity is anyway pretty high. In fact, World Health Organization had predicted that depression would be the second largest killer after heart disease by 2020. And they did not know about the pandemic at that time. And I'm sure that after the pandemic, it has definitely surpassed cancer in the number of deaths. So the severity is a lot. And if I look at what we see in the private practice, our slots are full. We are not finding available time for patients who have depression and anxiety. People who had a pre-existing conditions like depression or anxiety or any other condition like OCD, their problems have grown a lot. People who never had problems, for instance, children and adolescents who did not have problems, have started developing problems like excessive screen usage, irritability, depression, anxiety, and so on. So this is just the beginning. I'm sure that the effects are going to last for many years to come, and we need to take efforts in this direction right away.
The next question to you is, mental health condition exist on a continuum? If yes, then what are the diagnoses and treatments for this?
Oh, wow. That's a very, I would say, the answer would be extensive. Yes, the mental health conditions are on a continuum. So nobody's perfectly normal. And, we all have certain things, for instance, our thinking, our feelings, and our actions may be unhelpful to us in some or the other way. But when the same thing, for instance, your own thinking, feelings, and behavior, they start interfering with your happiness, with your functioning, for instance, your relationships, your work, your happiness, and any other area of life, for instance, finances. So then we call it as dysfunctional. And if the severity is enough and lasts for a certain amount of time, prolonged, then we call it as a disorder. So I think everyone can benefit with mental health care. We should not see people in black and white that this person has a mental health issue and this person does not have a mental health issue. To be very honest, anyone who procrastinates or postpones doing their tasks, technically they are having a mental health issue.
Yes. Yeah, agreed, sir. And what are the diagnosis and treatment for this, sir?
There are huge number of psychological and psychiatric, I would say, diagnoses. So to put it briefly, I would say anyone who has problems with their thinking, their feelings, or their actions, and they're not helping them in some way, or they are coming in the way of their functioning, for instance, relationships, work, or any other area of life like finances, we can call this as a disorder. Now, if it lasts beyond a certain period of time, now the time period is different for every single psychological problem, then we call it as a disorder. Now, the treatment could be of two types. Primarily, the treatment could be medical, which is giving them medication, because as we all know that we are a bundle of chemicals going here and there, we like carbon, hydrogen, oxygen, nitrogen, and other chemicals in body. So imbalance of these chemicals or some kind of disturbance in the chemicals can lead to psychiatric and psychological problems. So that needs to be corrected. And the second part of treatment is counseling or cognitive behavioral therapy, where the psychotherapist helps the clients or patients to change their thinking, feelings, and behavior. So to put your answer into brief, I would say medication and therapy are two primary modes of treatment of psychiatric and psychological problems.
Yes, sir. So how will we one know which treatment they need actually in?
Excellent question. How do we know that which treatment would we need? I would suggest that since there is a great overlap between these treatments and all the disorders may need both kinds of treatments, it is best to leave it to the doctor. So the first thing, if you notice that you're not feeling well in terms of your mood, or if you're not, you're doing something or not doing something that, troubles you or comes in the way of your functioning, then consult a doctor. The doctor would be the right person to refer you whether you need medication or therapy or both of them. So let the doctor decide. It's very difficult to give a blanket statement. You're
So
mute.
can you please give a piece of advice to our viewers?
Piece of advice to the viewers: just like you would go for a medical checkup every 6 months or a year, just like you would go to the dentist 6 months or a year, it is important to go to a therapist as well once in a while, just for the checkup of how you can benefit with therapy. Psychotherapists not only help people who have disorders but also help people who are distressed. Say for instance, you're distressed about something, like there is a diagnosis at home and somebody is ill, and then you feel distressed about it. Therapists can help you get over that distress even if you don't have a disorder. And the last one is development. If you're normal, even if you are high functioning, therapists can help you function even better. So I know of people who come to me just to manage procrastination. Say for instance, they're postponing tasks, or somebody wants to stick to their diet, or somebody wants to leave some kind of addictions like screens or alcohol or tobacco. So we can say that a therapist can help you develop. So just have a regular visit with a trained therapist once in a 6 months, and that's my piece of advice.
Yeah, okay. Thank you so for that, sir. So my last question to you is, how should mental health survivors take care of their mental health?
Survivors, it sounds like they have been through a war or a battle.
Yeah.
I would say all people who have dealt with mental health issues successfully, they can take care of, or people who want to not get into mental health problems, um, they need to follow what we call as mental health hygiene. So the top 4 or 5 things that I would want to tell people to improve their existing mental health or prevent them from getting into mental health problems, or who have already dealt with mental health issues, is number one, get enough sleep. So for adults, it is 8 hours of sleep. 10 to 6 is the time when it is ideal rest time. They must exercise for at least 1 hour a day, depending on their physical condition, of course, with the advice of their physician, right? Number 3, they must eat well. All food that they eat would rather be nutritious, right? So these are top 3 mental health tips, I would say, right? And number 4, do not believe everything that comes to your head. You may have negative thoughts, but just because you are thinking them does not necessarily mean they are true.
Yes. Thank you for that, sir. Thank you, sir, for this. This has been a rather riveting conversation with you, and hope we have spread a positive message through this video. For more such interviews, like, share, and subscribe to us on our YouTube channel, Facebook, Instagram, and visit our website www.medicallyspeaking.in. Thank you, sir, for your time. Thank you for watching. Thank you.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.